Welcome to At the Heart of Caregiving, the podcast for anyone caring for aging loved ones. Whether you're a family caregiver, healthcare pro, or trusted referral partner, we're here to share tips, advice, and real stories to make caregiving less stressful and more rewarding. The voices you'll hear on this podcast are AI generated, but the content is genuine and made just for you. So let's jump in and celebrate the incredible role caregivers play in the lives of seniors. Now, our AI hosts will take it from here.
Welcome back to the Deep Dive. You brought us a really critical topic today, something I know touches so many families. We're diving into a brand new program from Medicare. It's aimed specifically at supporting people living with dementia. And this is key, they're unpaid caregivers.
That's right.
Think of this as potentially, a real game changer. We want to unpack what it is, who benefits.
Absolutely. This is all about the CMS guide model that's guiding an improved dementia experience. We looked at the official CMS stuff, obviously, but also info from providers like Caring Senior Service about how they're participating.
Right.
The mission today, cut through the jargon, give you the essential insights. What's this offer? What could it mean for you?
Okay, let's get right into it then. At a high level, what is this guide model?
So fundamentally, GUIDE is a new test program from CMS, the Centers for Medicare and Medicaid Services. It's not permanent, not yet anyway. It's set to run for 8 years to see how it works on the ground.
8 years, okay.
Yeah. And the big picture goals are sort of threefold. First, pretty straightforward. Improve care quality of life, too, for people with dementia and their caregivers.
Makes sense.
Second, tackle the cost issue. The hope is it can help families, delay needing that expensive long-term nursing home care. Keep loved ones at home longer, if possible.
Which is huge, financially and emotionally.
Exactly. And third, it's about spurring innovation, trying new ways, better ways to deliver dementia care nationally.
Okay, so a structured Medicare-funded approach trying to really make a difference. Who is this actually for? Who's eligible?
Good question, because the eligibility is quite specific for the beneficiary, the person with dementia.
Right.
They need a confirmed dementia diagnosis. And that has to come from a clinician who's actually part of the GUIDE providers team.
Okay, so not just any doctor.
Needs to be linked to the GUIDE team, yeah.
Yeah.
They also have to be enrolled in traditional Medicare parts, A and B. This is important. It doesn't cover people in Medicare Advantage plans or PACE.
Got it. Traditional Medicare only.
Right. Yeah. And they can't currently be getting hospice care or living long-term in a nursing home, and this is really good news for a lot of folks, they can be living at home or even in an assisted living facility. That's perfectly fine.
Okay, traditional Medicare, confirmed diagnosis from the team, living at home or assisted living, no hospice or long-term nursing home. That seems to cover quite a few people.
It does.
And the program talks a lot about unpaid caregivers. How do they define that?
Yeah, the model's pretty clear. It's a relative or any unpaid non-relative who's helping the person with their daily activities, ADLs. Supporting that unpaid caregiver is absolutely central to the whole thing.
Right. They're recognizing that burden.
Yeah.
You mentioned support levels vary. How do they figure that out?
So CMS set up a tiering system. There are 5 tiers. People get placed based on 2 things: the stage of their dementia, mild, moderate, or severe, and whether they have an unpaid caregiver. And if they do have a caregiver, what's the assessed level of strain on that caregiver? Low, moderate, high. There's also a tier for folks with dementia who don't have an unpaid caregiver but still have pretty complex needs.
How do they assess that, the strain?
Providers use specific, standardized assessment tools to figure out both the dementia stage and the caregiver strain level. And that tier assignment, it directly affects the support level expected from the provider and also how much Medicare pays them.
That makes sense, tailoring it to the need. So how do you get these services? Do you just sign up somewhere?
You have to find a provider, a healthcare organization that's been accepted into the GUIDE model by CMS.
Okay.
Then you formally consent to get your comprehensive dementia care through them. It's called alignment. It's voluntary.
And does aligning mean you only see them?
No, that's a really crucial point. Aligning with a GUIDE provider doesn't restrict you otherwise. You keep your freedom to see any other Medicare doctor or hospital for, your other health needs. The GUIDE provider is focused specifically on that comprehensive dementia care piece.
Okay, that's good to know. It's an add-on, not a replacement. Once you're aligned, you're in a tier. What does the care actually look like day to day? What do they do?
Well, the care comes from an interdisciplinary team. And a really key person on that team is a trained care navigator, often your main point of contact.
Care navigator.
Yeah. And the required services are pretty broad. It always starts with a comprehensive assessment and care plan.
Mm.
And even if you've had assessments before, you must get a new one specifically for Guide when you align.
Why another assessment? Seems redundant, maybe.
Well, it's to make sure the Guide provider gets a really current, standardized baseline using the model's specific tools and criteria. It's essential for getting the tier right, building that tailored plan, and then tracking how things are going within the program.
Gotcha. Standardized approach. What else besides the assessment?
A huge piece is caregiver education and support. And this isn't just like handing out brochures. It includes practical skills, training how to manage difficult behaviors, for example, in-depth info on the disease, how it might progress, access to support groups, one-on-one calls for caregivers. Real hands-on stuff.
That sounds incredibly valuable. Anything else?
Yes. They also have to address what CMS calls health-related social needs, or HRSNs.
HRSNs.
Yeah, basically screening for things like housing problems, food insecurity, maybe transportation issues.
Yeah.
Things that aren't strictly medical, but definitely impact health. And then they need to actively help connect families with community resources to deal with those things.
So looking at the whole picture.
Exactly. And another really big one for peace of mind. 24/7 access. You need to be able to reach a member of your care team, or at least a dedicated helpline connected to your provider, anytime, day or night. Just giving out like a generic public number isn't good enough.
Wow, 247 access to your team. That's significant for dementia care, where things can change so quickly.
It really is.
How is this delivered? Is it all in person? Visits to the clinic?
This is where there's some good flexibility built in. A lot of the services assessment components, care planning updates, caregiver support can actually be done using telehealth or virtually.
Oh, that's great for access.
Huge plus, yeah. Especially for rural areas or if mobility is an issue. However, there's a catch for the higher complexity tiers.
Okay.
If the person has moderate or severe dementia or moderate to high complexity, even without a caregiver, that initial comprehensive visit, it has to be in person at the person's home.
Okay. So virtual flexibility, but an initial in-home visit for more complex cases. Makes sense. Are there rules on how often they have to check in?
Yep, minimum contact frequencies, and they vary by tier. For example, mild dementia with a caregiver. Minimum contact is quarterly. Moderate or severe with a caregiver. At least monthly.
Okay.
And if there's no caregiver, but it's a moderate to high complexity case, at least twice a month.
And how do they make contact? Phone calls, visits?
It can be in-person, phone, or audio-visual calls, like video calls. What doesn't count for these minimums, importantly, is just texting back and forth.
Got it. No texting for the minimum check-ins. Okay, now let's pull out something that really jumped out from the sources as a massive benefit, particularly for those unpaid caregivers: respite care.
Oh, absolutely. This is definitely one of the standout features of Guide. It's a direct acknowledgement of that caregiver strain we talked about. The model actually provides payment specifically for respite services.
Payment, you mean Medicare pays for someone to come in?
Yes. There's an annual cap. It's $2,500 per beneficiary per year, specifically earmarked for respite.
$2,500 a year.
Yeah.
Just for respite. Wow, that's not just a number, that's real time off. What kind of respite?
So the providers must offer in-home respite. They can do it themselves or contract with, say, a home care agency. They also can offer respite through adult day centers or even short stays in facilities, but those are optional offerings. The in-home piece is required.
So that $2,500 could pay for a professional caregiver to come to the house, give the family member a break.
Precisely. And looking at the info from Caring Senior Service, one of the providers participating, they put some numbers on it. Yeah. They estimate that for the eligible families, so moderate to severe dementia with an unpaid caregiver, that $2,500, depending on local costs, could mean somewhere between, say, 30 and 90 hours of paid home care help per year.
30 to 90 hours. I mean, for someone providing care around the clock, that's huge.
It's significant relief.
That's time for appointments, errands, or just breathing room. And this respite funding, it's on top of the payment the provider gets for the general care management.
Correct. It's a separate pot of money. The $2,500 annual respite cap is distinct from the monthly payment the GAI provider gets for doing all the assessments, care coordination, education support, everything else. It's specifically for caregiver relief.
Amazing. So who are these GAI providers? Can any doctor's office sign up?
The eligible organizations have to be enrolled in Medicare Part B and able to bill under the Medicare physician fee schedule. CMS actually set up 2 ways to participate. There's an established track for groups already doing this kind of comprehensive dementia care, and a new track for organizations that want to build or expand their programs to meet the GUIDE requirements. The new track folks get a prep year before the main performance period kicks in.
Okay, supporting new programs too. And I saw the term partner organizations. What's that about?
Right. So the main GUIDE participant, the one getting the Medicare payment, they can contract with other groups, partner organizations, to help deliver some services.
Like who?
Could be a home care agency for that in-home respite, maybe a local nonprofit specializing in caregiver support, or a social work agency for the HRSN help. The key is CMS pays the main GUIDE participant, and they pay their partners.
Got it. So that's how different community players can be involved. And you mentioned Caring Senior Services participating.
Yes, they are. Based on their materials, they're launching what they call a no-cost dementia care program under GUIDE. They're partnering with expert registered nurses, mentioning a collaboration with Pocket RN to deliver the care navigator and clinical support aspects.
Okay. And their model sounds like
It involves an initial virtual assessment, regular check-ins from a dedicated nurse for life, that's their term, and providing that 24/7 on-demand access we discussed.
And it fits the GUIDE rules?
Seems so. Their program, which they say starts July 2025, targets those traditional Medicare beneficiaries with dementia living at home or assisted living. And crucially, includes that funded respite piece, mentioning that 30 to 90-hour potential for eligible families.
Okay, let's shift to the money side for a sec. How does Medicare actually pay these GUIDE providers? Is it fee for service, like billing for each call?
No, it's different. It's not standard fee for service, and it's also not like a shared savings or total cost of care model you see elsewhere in Medicare.
So how then?
GUIDE participants get a monthly payment from CMS for every beneficiary aligned with them. It's called the DCMP Dementia Care Management Payment.
A monthly flat fee, basically.
Sort of, but it varies. The DCMP amount depends on which tier the beneficiary is in reflecting their needs. It's also adjusted geographically, for local cost differences, and there's a slightly higher payment for the first 6 months someone's in the program, recognizing that initial setup work.
Okay, monthly payment varies by tier and location. And you keep saying no cost for families. How does that square with these payments?
This is really a standout benefit. That monthly DCMP payment Medicare gives the provider, and that separate $2,500 annual pot for respite, neither of those is subject to any beneficiary cost sharing. No deductibles, no copays, no coinsurance for the family for any of these specific GUIDE services, the care management, the education, the support, the respite. Zero out of pocket for the GUIDE program itself.
That is huge, especially with dementia care costs being what they are.
Absolutely. It removes a major barrier.
What about other Medicare stuff? Can the GUIDE provider still bill for, say, managing diabetes? Or can the patient still see their cardiologist?
Good question. So the DCMP payment bundles in certain services if the GUIDE provider or their partner delivers them. Things like chronic care management codes, transitional care after a hospital stay, advanced care planning conversations. Those are considered part of the GUIDE service package for aligned beneficiaries. The GUIDE team can't bill separately for those specific codes.
Okay.
But, and this is key, it's not a total cost of care model. The beneficiary absolutely still uses their regular Medicare benefits for everything else. Seeing their primary care doctor for a checkup, going to specialists for other conditions, hospital stays if needed, all that continues under standard Medicare rules and billing.
Right.
And other doctors, ones not part of GUIDE, can still bill for things like chronic care management if they're providing that care to someone who isn't aligned with GUIDE.
Okay, so GUIDE covers the dementia management bundle and respite at no cost share, but doesn't mess with the rest of their Medicare coverage.
Got it.
Let's zoom out. Why is this program, a big deal in the grand scheme of dementia care in the U.S.?
Well, I think what's really significant is that GUIDE isn't just pulling ideas out of thin air. It's explicitly building on evidence and lessons learned from earlier research, pilot projects, demonstration programs, things that showed promise in improving dementia care and supporting caregivers.
So it's trying to take what worked and scale it up.
Exactly. It's embedding those evidence-based approaches into a structured Medicare payment model. It directly tackles that huge need for coordinated, comprehensive, interdisciplinary support for both the person and their family. And crucially, it puts dedicated funding behind relieving caregiver burden through that respite component.
And measuring success differently.
Yeah, the model referral isn't just looking at, say, hospital admissions. It's specifically designed to measure outcomes like quality of life for the person with dementia and caregiver strain or burden. Those are key metrics. Plus, with the new track encouraging providers to start programs and the embrace of telehealth, it really has the potential to boost access to specialized support, especially maybe in places that haven't had much available before.
This has been really illuminating. So, to quickly recap, GUI-D is this significant new Medicare test program. Offers comprehensive dementia care management, coordination, caregiver support, and that funded respite up to $2,500 a year. All at no Medicare cost sharing for eligible folks on traditional Medicare and their unpaid caregivers. Delivered through approved providers like Caring Senior Service, who are launching their version in July 2025. It really does feel like a potentially vital resource.
It definitely holds a lot of promise, and it leaves us with a pretty big thought, doesn't it? If programs like Guy take hold, if they prove successful and maybe expand, how could that fundamentally reshape the landscape? The actual availability and accessibility of good integrated dementia support across the U.S., and what might that mean for the future of family caregiving itself?
Really powerful questions, something for all of us to think about. If listeners think this might apply to them or someone they know, where can they look for providers?
CMS has said they will publish a list of the participating organizations. Keep an eye on the official CMS website, cms.gov. They're aiming to get that list up sometime in summer 2024. That'll be the place to check for providers in your area.
Excellent. That's really helpful. Thank you for walking us through all this.
My pleasure. Good talking through it.